Dr. Moore, when you say ultrasound guided, can you tell us like why? Because some people, we have patients that go, they'll have an injection and I'll say, well, did they use ultrasound or did they not? Can you tell us a little bit about why you would want to do that, and what if someone from the community is going to get their hip injected or to get a bursa injected because they're in pain? What would they ask the physician of, do I need ultrasound or do I not, and what are the pros and cons of that?
That's a good question. Musculoskeletal ultrasound can be helpful for a lot of different reasons. One reason is you can guide injections. Musculoskeletal injections are very, very common, and the most common way to do that across America is what's called palpation guided injections, where the physician presses on an area, says, all right, I think this is where I'm wanting to go. The tendon or joint or whatnot is deep in this area, and I'm gonna put the needle there and assume that I get it in the right spot. And that's the most common way people do injections. There's nothing wrong with that technique at all. I'm a huge fan of guided injections, particularly ultrasound guided injections, because I'm looking at the structure with ultrasound and I'm guiding the needle to that structure with ultrasound. And I definitively see the needle tip in the area that I'm wanting it, whether that be a bursa, into the joint space, other regions, and then I can see the injectate fill that area. And so it's helpful for a couple of reasons in my mind. One, it increases the accuracy of the injection. And if you look in the literature, palpation guided injections range anywhere from AC joint injections being 40% of the time accurate palpation guided, versus if you're doing it with ultrasound, 99% accurate.
Wow. So a big difference.
Yep. To knee injections, which are probably the most common thing that we inject in the musculoskeletal world, palpation guided injections can be around 70% accurate versus, again, 95, 99% plus. And if it's not accurate, you kind of have the feeling that you missed something in real time. And so one, there's the improved accuracy, and the hope is that if you're getting it where you're intending it to go, it's going to work better. Two, I'm able to see all the nearby nerves, vessels, things that I'm trying not to hit, and so I can avoid those things. Three, I'm able to use much smaller needles because I don't need to rely on the feel of the needle and the tissue, and so generally patients tend to tolerate that better.
Okay, so that would help us, I think, as physical therapists too, because sometimes they come back and they say, well, we got the injection, but it didn't really help. And so then we think, well, are we off on the diagnosis, or did the medicine actually go where it was
That is a very good point.
Go?
So when you do an injection, there's there's three outcomes. One, you get it in the spot that you're intending it to be, and you have really good pain relief, and we say, yep, that confirms the diagnosis. Two, you get it in the spot that you're intending it to be, and for whatever reason, the injection just never was going to be helpful. When you're doing palpation guided injections, you don't have that increased level of confidence that, yep, 100%, I got it where I wanted it to go. Whereas with ultrasound, you say, nope, I can look at the picture I took, the needle was in the joint, I injected it in that area, and so the destiny of the injection, it was never going to be helpful.